We are Trinidad Eye Hospital. Our organization is the essence of eye care redefined with a comprehensive approach to meeting the needs of our patients. We have two spacious locations at Masca Compound in San Fernando and the other in the northeast of the island, currently located in Paje, Tunapuna. Our two clinics are equipped with state-of-the-art machines used to diagnose, scan, test, and treat a wide range of eye conditions. We offer treatment for cataracts, glaucoma, retina, oculoplastics, and refractive issues, to name a few. One of the special things about TEH is that our team of technicians and doctors are 100% focused on taking the best care of every patient who walks through our doors. Our CEO, Dr. Ronnie Bowler, is a vitreoretinal subspecialist and surgeon and is a 2024 recipient of the National Hummingbird Gold Award for his contributions in medicine. With over a decade of experience leading the medical team, he has invested his time training a team of doctors using specialized protocols and processes, which have enabled the high-volume patient model to work for both clinics and surgery. Approximately 50,000 clinic interactions happen at our clinics each year, with more than 2,000 surgeries performed annually. Our operations span clinical, optical, screening, and surgery services. Throughout the year, we also partner with companies to facilitate and engage in educational sessions, both virtually and in person. Over the years, we have grown, and presently, we have over 100 people on our team traveling on this eye care journey together. Even our neighbors in the Caribbean have benefited from our eye care presence in the region. To date, more than 1,000 cataract surgeries have been done since 2019 using the traveling surgery model. At Trinidad Eye Hospital, we believe in increasing access to care. Thousands of diabetics have been screened, hundreds of children have received glasses, and hundreds of surgeries have been done for free. Our vision is to eradicate avoidable blindness. We are Trinidad Eye Hospital, preserving sight, enhancing lives.
Basically, the purpose of screening is to pick up any diabetic changes early enough that we can prevent preventable sight loss due to diabetes. So the earlier that any changes are picked up, the earlier treatment can be administered, and then we have a better chance of saving someone's sight. Anyone over the age of 12 is invited to have a diabetic eye screening once they are confirmed diabetic. We do not charge for the screening process at all. Whether you come into our office or we see you at our outreach clinics, there is no cost attached. A lot of people don't get their eyes checked until they notice that something is wrong. So usually when someone notices that something is wrong with their eyes, they're already at a point that it's probably very advanced. So that's why no matter how well you think you are seeing, you have to get your eyes checked at least once a year as a diabetic.
Myopia, or nearsightedness, is where the distance between the cornea and the retina is too long. Light rays focus in front of the retina instead of on it. With myopia, close objects will look clearer, but distant objects will appear blurred.
Welcome to Beyond Vision, an initiative on the Trinidad Eye Hospital dedicated to restoring hope and changing lives. Many of you may remember our previous charity surgery programs, Gift of Sight and Sight Saver, under which hundreds of patients received life-changing surgeries. These programs have been a beacon of hope for so many, and we are extremely proud of the impact that we have made so far. With the continuous growth of our organization, we have decided to transform our charity efforts to reach even more people in need. And so, I am pleased to introduce to you Beyond Vision. Our aim is to restore and preserve sight, but we need your support. Join us in this journey because together we can make a difference. Because we believe that sight is more than just seeing. We believe that the gift of sight is a gift of life, and that the gift of sight goes way beyond vision.
Hi guys, happy World MS Week. I'm Dr. Dubey and I'd like to talk to you about multiple sclerosis. So multiple sclerosis, what is it? Multiple sclerosis is a chronic autoimmune degenerative disease of the central nervous system. And what this means is that the brain and the spinal cord and nerve tissues, over time, it begins to become destroyed and replaced by scar tissue, or what we know as plaques. As a result, these nerves, they don't function as optimally or as normally as they should. And multiple sclerosis can affect anyone at any age, but usually presents in someone who's between 20 to 50 years old, and it tends to be a female. Now, because your brain is connected to the nerves at the back of the eyes, this means that multiple sclerosis can actually affect your eyes. And what would this patient present with? So usually they may present with one-sided severe ache or pain within one eye, and that may travel to the back of the eye. It may even progress onto the other eye, and this would be accompanied by a decrease in their vision, a decrease in your color vision, a decrease in your contrast sensitivity, and even some defects in your field of vision that have not been there before. And this is called optic neuritis, or inflammation of the optic nerve. And aside from the optic neuritis, the inflammation may even extend to other parts of the back of the eye, and even may cause the eye to abnormally move or abnormally rotate. You may even find that it may be skewed to a certain direction. You can't move the eyes to other directions. The treatment of multiple sclerosis, it tends to range from like steroids, IV treatments, disease-modifying agents, and even lifestyle modification factors, and co-managed with neurologists. All in all, this means that even if you don't have multiple sclerosis, you should get screened, or you should get your eyes checked regularly by not only your optometrist, but by your ophthalmologist, and even have a low threshold for seeing us if you notice any drops in your vision that have not been there before, any change in your color that you're not accustomed to, or any pain in the eyes that you're not comfortable with. Simply see us and we'll sort it out. So all in all, happy World MS Week and take care.
Okay, open your eyes and let the world in. Follow me on a journey into your body's second most complex organ after the brain. But pay attention now, all of this will happen in the blink of an eye. First job at hand, get inside. Let's follow this dust particle. It floats up and lands on the cornea. That's the outer dome covering your eye. You can feel its shape right now. Close your lids, put your index finger over them, wash your hands first, and move your eyes side to side. Feel that bump? That's it. No blood vessels here. Your corneas get oxygen directly from the air, so your eyes breathe. But it's full of super sensitive nerves. They sense something foreign, and the fastest muscles in your body get to work. Your eye blinks. That dust particle gets washed away. Let's try this again. The only way to get into the eye is with light. That's how your vision works, and it's why you can't see in the dark. Duh. But how do we see objects that don't emit light themselves? The light coming from the source, be it a light bulb or the sun, hits the object. Some of it gets absorbed, and some of it bounces off and enters our eye. It's a nice reflection on you. More on that a bit later. For now, it's way too dark in this room. Somebody flip a switch. Ah, that's better. We zoom along, going the speed of light, and pass through the cornea. It's dome-shaped to help focus light where it goes next, the lens. But before we get there, we pass through the pupil. It's not a black circle in your eyeball, it's a hole. Black because there's no light inside your eye. Red eye in flash photos is because the light from the camera is passing through and bouncing off the back of your eye. It's full of blood vessels in there, so your pupils glow red. But this pupil's too small, I can barely squeeze through. Ow, the light's too bright. The tiny muscles in your irises, that's the colored part of your eye we know and admire, have relaxed to make the pupil smaller. This doesn't let too much light in and protects your eyes from excessive brightness. Turn the lights down a little, and the iris muscles contract. The pupil gets bigger as the eye demands more light to be let through. There we go! We pass through and come upon the aspirin-sized lens. Like your ears and nose, your lens continues to grow throughout your whole life. And just like in a camera, it focuses the light even more. That way, it hits exactly where it needs to be on the retina. That's the back of the eye. I can see our human here is nearsighted. Things far away are blurry. Look at where the lens is focusing the light into a single point. It's not on the retina, but a little before it. This happens when your eye is slightly too long. If you're farsighted, things up close are blurry. That focal point goes behind the eye because your eyeball's too short. Don't worry, it's nothing a pair of glasses can't fix. Ooh, it's roomier in here than I thought. Hello? Well, it's because you only see about 1/6 of your eye when you look in the mirror. The rest of it is inside your head. Your eyes themselves are about the size of ping pong balls. And just within this seemingly small little organ, there are over 2 million working parts. Whoa, hold on. Everything's shifting to the right. Whoa, now to the left. Our human must be looking for something. Your eyes move thanks to 6 muscles holding them in the socket. Certain ones contract, and your glance changes direction. Up, down, left, right, all around. Okay, things have calmed down, so let's continue following the light projection. Say you're looking at a big bright apple sitting on a blue table. A yellow light bulb hangs above. If you could see the image in here, it'd be upside down on the back screen of your eye. It's because the lens bent the beam. But you can't see this picture on the retina because eyes aren't projectors. It's just light hitting some tissue on the back wall of your eyeball. There are nerves and special receptors back there. They turn the light coming into your eye into nerve impulses the brain then decodes and makes sense of. So, we journey further. Here are those receptors. They can be cones or rods. Cones are the reason your incredible eye can detect up to 7 million colors. Surprisingly though, your cones come in only 3 types: red, green, and blue. It's the combination of their work that allows you to see magenta, chartreuse, or cyan. Except for colorblind people. They might be missing one of those types, or they don't work as they should. So these people don't see certain colors at all, or things aren't true to their color. For example, if there's something wrong with your green-sensitive cones, green and yellow look reddish-brown. There are also your rods. They pick up black, white, and over 500 shades of gray in between. Way more than 50 shades of gray. You also have more of them than cones, and the rods are mostly in charge of your peripherals. Yep, everything outside your direct field of vision looks like old black and white TV. Rods also help you see in low light. The photoreceptors in your eyes are so sensitive, they can even project an image when it's not even there. Ever looked at a bright light, closed your eyes or turn off the light, and you can still see the shape of that light bulb floating before your eyes? That's your photoreceptors continuing to send visual information to your brain. Your rods and cones are connected to neurons, so the data gets passed there and makes its way to your optic nerve. This is where blood vessels and the main path to the brain enter and exit the eyeball. This is also where your blind spot is. There are no rods or cones here. You can test it too. Grab a piece of paper and a pen. I'll wait. Okay, make a dot on the left side and a plus about a hand's length to the right of it. Hold the paper at arm's length. Close your right eye and stare at the plus sign. The dot will disappear because it's in your blind spot. If it doesn't, move the paper closer or further away until the dot disappears. Do the same thing with your left eye closed and stare at the dot with your right eye. The plus sign will vanish when it enters your blind spot. You don't notice these spots because your brain fills in the missing information. So, we travel along the optic nerve and into the message decoder, your brain. Ow! Shocked me. Oh yeah, we're in the nervous system now. So, we're traveling with electric impulses. The optic nerve leads into your brain's visual cortex. This is where that upside-down image gets translated into something we understand. That's a blue table with a red apple sitting on it. A yellow light shines above. And your brain knows up and down thanks to your ears. Well, your balance system, which is mostly in your ears. Anyway, the brain is also where missing puzzle pieces, like the stuff in your blind spot, gets filled in with information based on its vast collection of archives. The dot on the left is my blind spot, so I'll just fill in the missing space and make it look like the paper continues seamlessly there. But our journey didn't start when we entered the eye with light. It started when light from a source bounced off an object and then into the eye. Why do we see different colors? Because visible light travels in different wavelengths. That red apple on the table absorbs other colors and reflects red-white waves, also pronounced as red light waves. The table reflects blue, and so on. Black objects absorb all the light, and white things reflect most of it. Those reflected waves hit cones and rods sensitive to them, and your world is filled with color, especially red-white waves.
Have you been delaying taking care of your eyes? You could risk losing sight of those you love the most and even put yourself in harm's way. Don't wait until it's too late. At CVRS, sponsor of Trinidad Eye Hospital, we can help. We offer surgeries for cataracts, retina, and glaucoma with subsidized pricing to suit your budget. See your loved ones clearly every day. Preserve your eyesight. Call us at 235-4834 today. It is estimated that 463 million people are living with diabetes in the world today. Approximately 200,000 of them live in Trinidad and Tobago. 1 in 3 persons living with diabetes will suffer some degree of diabetic retinopathy, with 1 in 10 developing some vision-threatening form of the disease.
Diabetes affects the eyes in many ways. And one of the ways we see it affecting the eyes is that it promotes cataract formation. And therefore, a lot of the cataracts that we do on charity surgeries are in diabetic patients. But we've also been able to introduce bleeding type surgeries that diabetics get to be able to clear the blood out of the eye, called a vitrectomy.
Pamela is 50 years old and has been living with diabetes since the age of 25. She has been living with poor vision due to diabetes. Pamela and her family cannot afford the eye surgery that she needs to improve her vision and her quality of life.
I want to read, I want to do plenty things. I want to see because I can't make out like far, I can't make out nobody until I come close to me.
Bazde is 64 years old and has had difficulty controlling her diabetes over the years. She's almost legally blind and is hopeful that eye surgery can help her to see again one day.
Can I see the plane? I'll see one of the prison. I can't go back, I don't know what can help.
diabetic retinopathy affects the eyes in many ways. The way that a country or a community could reverse or curtail the effect of diabetic retinopathy on the eye is by screening. So if we screen a community, we'll be able to reduce the amount of blindness and the amount of dependence on diabetic complications. We decided that we needed some way to take it to the next level, and we decided to engage Dr. Vineet Kumar, who is a specialist in diabetic retinopathy screening. For the last 10 years, he's been doing it out of the UK.
I am Vineet Kumar, born and brought up in India, in the beautiful city of Bangalore. Studied medicine in a place called as Government Medical College, Bellary. Pursued my interest in ophthalmology in the UK. Being fortunate to have been a consultant out there for about 10, 11 years. I got a chance to participate in diabetic eye screening program as a clinical lead for the Wirral University Teaching Hospital and participate with some work in the national program as well. With all this background and our conversations with my friend Ronnie out here in Trinidad, we said, can we take this further and you come over to Trinidad and participate in the program being done out here? I did not have to think twice after having spent a few months out here. I in fact resigned from my job in the UK overnight, and I messaged him and he was laughing. So this is the true story. I'm not giving you anything else, and I've landed up out here and I see that there is some synergy, not just with him, but synergy with the people who are participating in delivering eye care. And one of the things that we look forward, and I look forward particularly to participate in delivery of eye care in the best form possible, not compromising on quality, governance led, so that we can assure ourselves that we're delivering this quality care, educating the next generation doctors to the highest of quality, because my personal view is teaching allows me to be a continuous student, and also participating amongst the community to raise awareness about eye care, in particular diabetes and the relevant eye disease, because this is definitely avoidable. All we need to do is take some care of it.
Pamela's surgery improved her vision significantly, along with her quality of life.
I want to say thanks to you all, and I want to say thanks to Dr. Bolani crew, and I want to say a special thanks to Priyanka. I want them to help the poor people out there, because I get help. I want to be thankful. So we can try and help other people like myself.
Many times, delays in access to eye care interventions can lead to poor outcomes. After surgery, Bazile's condition was stabilized, but improvement in her vision was minimal.
When you cannot see too good, is the next thing, because you can't do this and that to say where you go clean your hand there and all about. And it's clean here, but I can't tell you exactly what I'm doing.
If it's clean but not clean. But it's a nice job you are doing. We have to thank all of us still hope how to get we to reach. The only thing now is for we to wait and see what we want. We have to thank all you and the sponsor them. Thank them very much for helping us to reach that part.
love being a part of it because to me, when you see a patient whose life is so severely impacted by their inability to see from something that's preventable, and you could make a difference to help them regain that sight.
Hey, my name is Sanol Munesa. I'm the Managing Director of ICU Ophthalmics. So we're here today to partner with the doctors, the nurses, and the medical center to bring that gift of sight to patients that really need that sight.
Activity with a purpose. So everything has a purpose and a reason, and the main reason was eventually getting the patients to see.
Patient satisfaction, the response and like what patients give you feedback on with their vision, there's something that they're very happy, and it makes me happy too.
When people give, it's a natural human instinct or need that has to be filled, and this is inherent in all of us, and it makes us happy. And people only want one thing in life, they just want to make themselves happy. And this was a way in which we could let people experience what we experienced, and we know it was going to give them happiness, and therefore that drove the project.
So a cycloplegic assessment is an examination most commonly performed in kids, whereby we use eye drops to relax the eye muscles and thereby prevent over-focusing. These tests are used to determine the child's correct prescription and also identify any underlying eye conditions that may be prevalent. Some symptoms kids may experience that indicate the need for a cycloplegic assessment include frontal headaches, difficulty focusing at school, holding objects unusually closer, especially phones, tablets, laptops. Any one of these symptoms or a combination of these usually indicate an underlying eye disorder which needs a cycloplegic assessment.
Performing a cycloplegic refraction is a very simple process. The first step entails numbing the eye using some anesthetic drops, followed by cyclopentolate, which is the drops we use to numb the muscles that control the lens inside of the eye. The drops are instilled at around 15 to 20 minute intervals, and then the optometrist will check to make sure the pupils are dilated and no accommodating or over-focusing is being observed. So once the eye muscles are relaxed, the optometrist will put on special glasses, we call them a trial frame, and insert lenses into this frame. A light will be shined into the child's eye to accurately calculate the optical prescription. A final assessment is done on spectacles collection to ensure that the patient is happy and comfortable with their new glasses.
The silent thief of sight. What happens in glaucoma is the disease is going on in the eye and you don't know, because there is no symptoms in the majority of cases. So glaucoma is caused, we think, by the pressure in the eye going up in the majority of cases we see, because of clogging of the drainage system in the eye. And this here is an eye model. And basically fluid is produced in the back here, just behind the colored bit of the eye, passes through the pupil, the little hole here, and drains out into the drainage system in the front of the eye. And we think over time, just like a sink, it gets clogged up. And that clogging up causes the pressure to rise. And as the pressure rises, it puts pressure on the optic nerve, which is here, and it causes damage to the nerve over time. So two things we check when you come into the office. One is we check the eye pressure to see if it's going up, and we take a look at the optic nerve to see if it's getting damaged, and that's how we diagnose it. The different types of treatment for glaucoma, and I'll talk about two to start with, which is drops and laser. The compliance with drops is really difficult, to give somebody to have to use a drop for life every day. It's an onerous process. And laser is a one and done procedure. It lasts on average 2 years to 5 years, and we monitor the eye pressure. The other recent innovation in glaucoma treatment called MIGS, and microinvasive glaucoma surgery involves opening up the drainage channels with surgery. And those two procedures are highly effective and really prevents you from needing either drops all the time or needing to have major glaucoma surgery. I know we might have persons who would be listening to this video and they have glaucoma and very worried that they're going to go blind, they're going to lose their vision, or the treatment may affect them. The laser, for instance, they think might burn the eye or cause some harm. The answer is no. Don't be worried. Because of the advances in the treatment, we have been much better at controlling the disease. The aim in glaucoma treatment is to prevent deterioration in vision. It cannot bring back what you've actually already lost. And that is why it's so important to stress getting your eyes checked. Because if you've lost a bit of vision already, you could end up losing more vision, and we can't bring back what you've lost. So it's important that we save what you have. So get your eyes screened.
At CVRS and the Trinidad Eye Hospital, we take care of all your family's eye care needs. Get comprehensive eye exams for the entire family, and then get referred to our in-house ophthalmologist if needed. We have a wide variety of sunglasses and frames for adults and children, and you can even get contact lenses too. Call us at 620-1025 today.
The Comprehensive Dilated Eye Exam, opening the door to preventing blindness. A doctor can detect signs of glaucoma during a comprehensive dilated eye exam. The patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. To look for early signs of glaucoma, the doctor will examine the optic nerve. This patient's optic nerve is healthy, but here's what it would look like if it showed signs of glaucoma. The doctor will see changes in the shape or color of the optic nerve. He or she may also see what is called cupping of the optic disc. Glaucoma is most common in African Americans over the age of 40, people over 60, and in people with a family history of glaucoma. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about comprehensive dilated eye exams, common vision problems, and eye disease, visit www.nei.nih.gov/healthy eyes.
Glaucoma is a group of eye conditions that damages the sensitive nerve in the back of the eye. It can eventually lead to blindness if left untreated. In the early stages of glaucoma damage, peripheral vision is lost at first, so it may be unnoticeable until it gets worse. The damage from glaucoma usually occurs because of high pressures in the eye. The high pressure can lead to small damages until it becomes major of the optic nerve, and then it can lead to blindness if left untreated. The treatment for glaucoma depends on the type of glaucoma that a patient might have. There's the open-angle glaucoma and closed-angle glaucoma. The first-line treatment is eye drops. The aim of eye drops is to lower the eye pressure to preserve any further damage of the optic nerve. Eye drops have two mechanisms. Firstly, they can release the amount of fluid that is being produced in the eye, and they can also increase the amount of fluid being drained from the eye, and this has an effect on lowering the eye pressure. Other treatment may also include laser, which can open the existing drainage channels in the eye, or surgical if eye drops and laser is proven to be ineffective. If eye drops and laser is proven to be ineffective, surgical management is then advised. And there are different types of surgeries that is possible for glaucoma treatment. One of the surgical techniques that we use to control the pressure in the eye and prevent further damage from glaucoma is where we open up the natural drainage systems in the eye to allow fluid to flow better and release the pressure. The other method we have is where we put an artificial drainage system or a valve in the eye that can open and drain fluid when pressure builds up, thereby releasing the pressure and preventing any further damage from glaucoma.
The human eye. It is through our eyes that we know so much of the world, but sometimes our eyes aren't at their best and need care. Our eyes might get cloudy. We might see dark spots. We could lose vision on the side or in the center. But in the beginning stages, we might not notice any symptoms of these problems. If they aren't caught and treated early enough, they can cause blindness. This is why it's important to have regular exams with an ophthalmologist, even if you don't have symptoms. In these exams, ophthalmologists can spot the early signs that we can't on our own and can help our eyes get healthy again. So don't wait. Have regular eye exams, especially by age 40, when your eyes start to change. This can help keep your eyes healthy and happy well into your golden years. To find an ophthalmologist, an eye physician and surgeon, and to protect your sight, visit the American Academy of Ophthalmology's EyeSmart website.
When we started our eye care journey, our goal was to make high-quality eye care available to all. Since then, our mission and vision has grown stronger and continues to unfold. Our new look and feel is a reflection of who we are. And as you experience it, we hope you get a sense of our values and our passion for serving your eye care needs. We are committed to the continuous development of a comprehensive eye care service that can provide greater access to eye care until we reach our goal of eradicating needless blindness. We are Trinidad Eye Hospital, preserving sight, enhancing lives.
Diabetic eye disease refers to a group of eye problems that can occur as a result of diabetes. Without diagnosis and treatment, diabetic eye disease can cause severe vision loss or even blindness. Diabetic retinopathy is the most common diabetic eye disease and is a leading cause of blindness in persons with diabetes. It is caused by changes in the blood vessels of the retina. The retina is the light-sensitive tissue at the back of the eye. A healthy retina is necessary for good vision. In some people with diabetic retinopathy, blood vessels of the retina may swell and leak fluid or blood. In other people with diabetes, abnormal new blood vessels grow on the surface of the retina. At first, diabetic retinopathy may not cause any changes in vision, but over time, diabetic retinopathy can get worse. At first, a person might see spots floating in their vision, or may notice a general blurring of vision. Eventually, diabetic retinopathy may cause vision loss and even blindness.
TH Optical was formed by consultant ophthalmologist Dr. Ronnie Bowler and senior optometrist Ibrahim Mohammed. Together, they developed a shared care system using the best technologies available, with the goal of making high-quality eye care affordable and accessible to all. TH Optical. For more info, follow us on social media.
Astigmatism is when the cornea is unevenly curved. Usually the eye is round like a baseball, but with astigmatism, it is more oval-shaped like a football. Light passing through this unevenly shaped cornea is not properly focused on the retina. Distance and close vision may both appear blurry.
So the retina in the back of the eye is one of the most highly metabolic tissues in your entire body, meaning it thrives on having good nutrition. And many foods and nutrients have been found to not only delay, but also prevent eye diseases and help improve your eyesight and visual function. So in this video, we're going to share my 5 best foods for eye health and vision that you can start eating today. Let's take a look. Hey, what's up? Dr. Allen here from the Dr. Eye Health Show, helping you to see your best today and also tomorrow. Now, number 1 on our list for the best foods for your eyes is, funny enough, not carrots, believe it or not. In fact, sweet potatoes. And the reason for this is because sweet potatoes have almost double the amount of vitamin A that a carrot will in a single serving. Perhaps the best well-known nutrient for the eye is that of vitamin A, which is an essential nutrient that's needed for the ability to detect light within the retina and sends chemical signal to your brain to form images to let you see. This happens to be most helpful for seeing in low light situations, such as maybe driving at nighttime. Vitamin A also plays a role for prevention of dry eyes. In fact, eye doctors like myself are trained to always look at the surface of the eye for the growth of something called a Bitot spot, which is something that we see in people who are severely vitamin A deficient. Yes, carrots can help you with vitamin A, but sweet potatoes, again, have a little bit more, and personally, are just a little bit more my favorite. Let me know in the comments if you prefer carrots or sweet potatoes. Number 2 is that of eating green leafy vegetables such as kale and spinach. And that's because green leafy vegetables have been found to have high concentrations of lutein and zeaxanthin. Lutein and zeaxanthin are carotenoid pigments that are found in super high concentrations in the macula in the back of the eye, which is essentially the bullseye of the center part of your vision that gives you good, sharp reading ability and your ability to see colors. Lutein has been found to play a significant role in reducing chronic eye diseases such as cataracts and macular degeneration, and basically acts as like a natural blue light blocker for your eye. There's even studies showing support that lutein can help with diabetic retinopathy. And hey, if you're like me and you don't like eating salads, that's okay. Throw this into a blender, make a green smoothie out of it, it's delicious. Plus there's like 1.5 million different recipes for green smoothies, and spinach, when it's blended up, you really can't taste it. So if you haven't tried them, I suggest it. Number 3 on best foods for the eyes is fruits that are rich in vitamin C, such as citrus fruits such as oranges, tangerines, and even lemons. Vitamin C is a critical antioxidant in our body and is found in really high concentrations within the aqueous fluid inside of the eye. This basically works to help prevent free radical damage from all of the unhealthy parts of our lifestyle, whether it be food, daily habits, or just environmental exposures. And so vitamin C is constantly helping to prevent things like cataracts and macular degeneration inside of your eye. So yes, get your vitamin C. Okay, maybe don't bite into a lemon. Number 4 on our list are foods rich in omega-3 fatty acids. Some examples include having salmon, tuna, other cold water fish, or perhaps a nut or vegetable source such as walnuts. Omega-3 fatty acids play an important role in the development of our brain at an early stage, and even for the development of the retina in the back of the eye. And studies have even shown that diets rich in omega-3s have helped with patients who have macular degeneration, diabetic retinopathy, and even dry eye disease. Some people may choose to go the route of omega-3 supplements. However, some studies have found that people eating a diet source of omega-3 have had better results for different eye health conditions versus doing supplements alone. But I do recognize that there's a lot of research on this area of omega-3 supplements specific, not just in eye disease, but in heart disease, bone health, brain health, a lot of different parts of science. And it's something that I've been studying on my own accord and hope to have further videos specifically around omega-3 supplements and for the eye. And so if that interests you at all, definitely I encourage you to subscribe to the channel if you haven't done so already. That way you'll be notified when that video comes out. Otherwise, as always, if you're considering taking any supplement, I always encourage you talk to your local eye doctor or healthcare professional in your area just to make sure it's an okay choice for you. Now finally, number 5 on our list is that of foods rich in vitamin E and zinc. I know beans and legumes are an easy way to get a lot of zinc into your diet. Zinc plays an important role in helping convert vitamin A into melanin in the back of the eye, which is very protective against oxidative damage and damage from sunlight and other sources, and has also been found in the prevention of cataracts, macular degeneration, and helping with low light situation and night vision problems. Vitamin E has also been found to be super beneficial for the health of the eye and can be easily found in things like avocados, almonds, and sunflower seeds. Hopefully you found this list helpful and educational. If so, smash that like button for me and let me know in the comments section some of your favorite foods and if they made this list.
Cataract and glaucoma may present similarly in that the person might be experiencing cloudiness. They may also lose some peripheral vision, right? In terms of, I guess they all present that way, in that there is a blurriness and people notice that there is a decrease in their vision, right? So the external images, we will see that there is a blockage over the lens of the eyes. So we will see a cloudiness. It usually looks black or white in color. So that allows us to know that there is something abnormal there preventing us from seeing in clearly. So glaucoma now is, we look at the physical appearance of your optic nerve. There is a certain range that the ratio should fall in between. So anything larger than that, that allows us to note that there may be suspicion of glaucoma. So it would present as bleeding, it would present as poor blood vessels, which is the body's attempt to get blood around the eye because of poor circulation from the diabetes and the sugar affecting the vessels.
So today we're going to talk about the retina. The retina is that part of the eye that captures the image that you see. I like to describe it as analogous to a camera, and that is the old style camera that used to have film in it. And the film in the camera is like the retina in the eye. It gets the image, and then that image or information is transmitted via the optic nerve to the brain. So the retina is actually extremely important to be fully functional for us to get a good image and an amazing or clear vision. So you can imagine any problem with the retina or any condition that affects the retina would affect your overall vision. Conditions that can affect the retina include diabetic retinopathy, which is probably the most common cause of damage to the retina, or hemorrhage into the vitreous, which is right in front of the retina, and both of these conditions need retinal surgery. Other conditions such as macular holes, which is a condition that affects the central part of the retina called the macula, will need retinal surgery. Things like a retinal detachment that develops as the retina and the vitreous humor changes with age. That also needs retinal surgery to correct. So what is retinal surgery and how do we do retinal surgery? Well, retinal surgery and vitreous surgery, we use them interchangeably. Vitreous surgery or vitrectomy is the removal of the vitreous humor, and then that really allows us to do work on the retina. So all retinal surgery usually involves removal of the vitreous humor and then repair of the retina. To get into the eye, we have to make these little micro incisions the size of needle heads on the eye. So we have to freeze the eye so that it's painless surgery and then perform the surgery. Almost 95 to 99% of all retina surgery is done under local anesthetic, which is drops and anesthetic just around the eye, and the surgery is usually very pain-free. In the retina surgery, once we reattach the retina, we have to keep it reattached, and to do that we usually use a tamponading agent, and that is either a gas or oil, and these things will obscure the vision for a little while until they're either removed or they are removed naturally by the body.
Have you been delaying taking care of your eyes? You could risk losing sight of those you love the most and even put yourself in harm's way. Don't wait until it's too late. At CVRS, sponsor of Trinidad Eye Hospital, we can help. We offer surgeries for cataracts, retina, and glaucoma with subsidized pricing to suit your budget. See your loved ones clearly every day. Preserve your eyesight. Call us at 235-4834 today.
When we started our eye care journey, our goal was to make high-quality eye care available to all. Since then, our mission and vision has grown stronger and continues to unfold. Our new look and feel is a reflection of who we are. And as you experience it, we hope you get a sense of our values and our passion for serving your eye care needs. We are committed to the continuous development of a comprehensive eye care service that can provide greater access to eye care until we reach our goal of eradicating needless blindness. We are Trinidad Eye Hospital, preserving sight, enhancing lives.
No matter how well you think you are seeing, you have to get your eyes checked at least once a year as a diabetic. So when they come in, we take a short medical history, then we do a visual acuity test that basically allows us to see how well someone is seeing. So after that, we dilate the person. So dilation is basically drops in the eyes. Those drops allow us to see clearly to the back. What it does is it opens the pupil and prevents it from reacting to the light when we flash you. So it takes about 10 to 15 minutes for the medication to work, and then you come for the photography process. So when we take pictures, we look at different areas of the back of the eye, so that gives us a good understanding of exactly what's going on in the back. And then we also look at the outside of the eyes for anything abnormal like cataract or any growth that may be abnormal on the outside of the eyes. After we look at the images, what we do is a process called grading. So grading will allow us to know the severity of any diabetic disease, and it also allows us to know if there is absence of disease.
Always wash your hands before putting in your eye drops. Remove the cap to the eye drop medication and do not touch the dropper tip. Tilt your head back slightly. With one hand, pull your lower eyelid away from the eye to form a pocket. You can do this by pulling the lower lid down with your index finger. With your other hand, hold the dropper tip directly over this eyelid pocket. Look up and let the eye drop fall into the pocket without touching the bottle to your eye or eyelid. to prevent contamination of the bottle. Close your eyes and do not blink, and apply pressure to the point where the lids meet the nose. Hold for 2 to 3 minutes, or as long as your ophthalmologist prescribes. Before opening your eyes, and this is very important, wipe unabsorbed drops and tears from the closed lids with a tissue. Then open your eyes.
The value of our lives cannot be determined by what we do for ourselves. The value of our lives is determined by what we can do for others. The aim is to be able to bring quality, affordable eye care to poor people. And how are we going to do that? We have a company which will make money, and we have a non-profit, which is Trinidad Eye Hospital. And Trinidad Eye Hospital will have programs to do free eye surgeries, to do free screening, so we pick up disease before it happens. And CVRS will also have programs where we do subsidized programs. Welcome to CVRS and Trinidad Eye Hospital, San Fernando.
What is low vision? 3.5% of the population has a problem diagnosed as low vision. And that's 246 million people worldwide. Low vision is a lesser degree than blindness, but which still cannot be corrected by either surgery or wearing eyeglasses. Sometimes it can prevent us from doing activities as simple as going to work, practicing ordinary sports, driving, or watching a film. It can be caused by many different illnesses: glaucoma, albinism, aniridia, age-related macular degeneration, high-degree myopia, retinopathy, retinitis pigmentosa. Here are some examples of how we might see the world. Only peripheral vision, tunnel vision, patchy vision, night blindness, whiteout, or loss of contrast. Sometimes it's hard to spot us. We don't always use dark glasses or a white cane. And some of us can even read our mobile phones or a newspaper. But then we might fall over any object. That is why we've created this identifying badge. We want our symbol to be recognized the world over. That means when you see us in the street, you can take a little more care, and our lives will be much safer.
El uso del distintivo tengo baja visión me hace sentir mucho más tranquila.
Normalmente salgo siempre acompañada, pero cuando me surge que tengo que salir a la calle sola, pues me encuentro como más segura.
El otro día iba por la calle y me despisté un momento y me choqué con una chica. Pero llevar el distintivo tengo baja visión me hizo sentir protegida. Nada más hacer así, ella entendió perfectamente y cambió completamente de actitud.
Por ejemplo, en los comercios, cuando me tienen que dar las vueltas, me suelen dar, antes ponían en el mostrador y ahora me suelen dar a la mano.
Thank you for spreading this campaign, which will improve the quality of life for many people.
at 1 point something, I should say. Yeah. Million? Not billion. At 1 point something million, I'm guessing so, yeah.
I just need, the basics, house, land, car. So I think I could be happy over 5 million, yeah.
10 million. That is it, 10 million.
At least 15 million or around there. Yeah.
If I'm getting that opportunity, I would want $5 billion. Billion.
As it would be like, I don't know, $800 billion. Sure, that'll set me for life. It won't be totally bad.
Sight. I will function better with sight, yeah.
I will see. I don't matter. I just will see. Don't put me in that.
I think I'll have to go with hearing because, I mean, will I turn into a superhero? could I be Daredevil? That was my first thought. Like, if I have my hearing, I could be a superhero.
I will keep sight. Here's the reason why, right? I have a reason. Right? So I don't need to hear you. It's a date, right? So I could read lip, right? I could lip read and turn on Netflix captions. I don't need to hear, right?
I don't need to hear, I don't need to smell, I don't need to touch, I don't need to taste, whatever. I'm good. You're really sight.
Would I take the $2 million? No. No. I think my eyes, no. I can't do without my eyes. Have to see, yeah, have to see everything.
In this case, no. I would prefer taking my eyesight. Because money is not everything. So
my family could be better off, yeah. Once they could see about me, because I can't do nothing.
I don't feel I'll get to enjoy the money as much without the eyesight. Why? What's the point of going to Dubai if I can't see any of it?
I think if I had to pick, I would definitely pick my eyesight. Yeah, I can't imagine not seeing, a carnival band on the road on a Carnival Tuesday and seeing my little cousins playing in the yard and seeing my grandmother. So, my eyesight.
My changes will be like regular eye test checkups. Like make sure my eye on point, not too close to TV, glare, them kind of stuff. But yeah, but regular eye test, yeah.
Well, generally eating healthier foods. I think that would be the first one that I am already passively trying to do, and it will probably take a more active role.
So I do check my eyes every year. I guess one thing that I would change is probably try to eat better and more of those foods and fruits and vegetables that support eye health. Yeah, and reduce the screen time because sometimes as we scrolling too much on TikTok.
I'm guessing I'll have to put all the effort in taking care of it, especially with diet, because I know depending on what you eat could affect your eyes, especially, if I had gone down the ice cream lane, that could lead to diabetes, and diabetes affect your eyes, right? So I guess health-wise, I would have to taken it serious.
What I have found is eye exercises is one. And I know I have a couple of friends who did that and who have glasses, and their prescription changed for the better with actually the eye exercises.
Sanitizing all my eye products, washing my hands more often before touching my eyes, because that is a bad habit that I have. With doing your makeup every day and having things around the eyes, it's always something that I'm conscious of, getting all of that eyelash glue and mascara and eyeliner off. But I guess maybe I have let it lax a little bit, and it's been more than 2 years since I've had my eyes checked, so I will definitely get to that.
Today is December 16th, 2024, and we are doing our Beyond Vision charity surgeries today. We have 10 cases that we hope to give the gift of sight to.
The team really wanted to be able to do surgeries every month and to get these charity surgeries in and through. And to do that, you needed an organization specifically geared towards generating funds to be able to get these surgeries done monthly. And Beyond Vision was created for that.
PARIA tends to align itself with sustainable programs that will both benefit the people itself and also their families. When we were approached by the Trinidad Eye Hospital, we saw this as an opportunity to give back to the different people within different communities, as we saw sight as an important aspect of any human being.
Yes, thank you for all the doctors and them who looking after me, all the nurses, all the patients. I want to thank all of them. And you too. And your whole family.
At CVRS and the Trinidad Eye Hospital, we take care of all your family's eye care needs. Get comprehensive eye exams for the entire family, and then get referred to our in-house ophthalmologist if needed. We have a wide variety of sunglasses and frames for adults and children, and you can even get contact lenses too. Call us at 620-1025 today.
I want to talk to you about a problem that affects millions of us: dry eye. We don't all have the same dry eye symptoms. Sometimes I get so irritated, I water more than usual, or I can get red and sting. Sometimes I feel like I'm in a hot desert sandstorm with no shelter. There are lots of reasons dry eye occurs: allergies, air pollution, asthma medication, spending too much time looking at the computer, and so many more. I went through all the possibilities. Luckily, there are plenty of do-it-yourself solutions to help ease the symptoms quickly. And for most of us, a few simple lifestyle changes will do the trick. If these simple changes don't work and your eyes are red and painful, visit your ophthalmologist right away. Dry eye can be a sign that something else is going on with our body. Learn more on how to say bye to dry eye. Visit the American Academy of Ophthalmology EyeSmart website.
Until about mid 2017, the vision start getting blur and blur until we get to the point where I lost the vision. Lost the vision in the sense of viewing something, identifying something, no, but I cannot identify nothing. Even my hands, I can only, as time goes on, I can only see the shadow, and the shadow get pale and pale up until I get here. I am trusting that, within a few weeks from now, hopefully, I'll be able to look at the world and say, is it such a beautiful place? Right? I hope for the best, I hope I'll be able to do my little stuff again, little by little, until, I can smile at the storm. Right? I was hoping that the day would come when something like this would have, when I happen to go to the process as it is today, and the rest will be left up to God.
Open both eyes. And watch me now.
Doctor, I've seen a picture when you open a while ago, yes.
Yeah, open
I'm seeing
both
you
eyes.
right now. I'm looking at you for the first time in 1.5 years. I saw you right here. I can't believe it. I can't believe it. Wow, this garbage. 4.5 years I'm in darkness. I'm pleased, I'm thankful, very, very thankful to you all. This makes a big difference. It's hard to believe, but it's true.
When you stand up now.
1, 2, 3, 4. Person, I'm glancing at. There's a big change.
So you can stand up.
And stand up.
Yeah.
Stand up straight. Wow, very different.
And now you could walk.
My friend is right here. Oh, this is good. Folks, bless you all. Bless you all. I'm thankful. And I know you all did a wonderful job yesterday. I speak of it so many times. And I will be speaking much more. I'm thankful, and I strongly believe when I can move really, I'll be coming back here to tell some folks many, many times. Right? Very, very good, right? Because I know the darkness I was in for 4.5 years. And this is the first I've seen. Like the world is a beautiful place. And some beautiful folks around me, right? Right? Thank you all. You did a good job. Wonderful job. I'm pleased. Very pleased.
Well, the reason why I never done my assessment is because I wasn't taking on the fact that I could make out certain rules and certain things from far. I thought it was like a normal thing with my vision.
Alright, like I couldn't see the board, I couldn't see things from far. Okay, even like when I wanted to do basketball, I couldn't see the hoop. And it was like real difficult. I know now I could read good, I could see better, so I'm going back to my A and my B.
Our children are the future. Teachers, lawyers, doctors, leaders of tomorrow. Sadly, 20% of them have no access to glasses. This affects their grades, confidence, and potential to become who they want to be. This year for World Sight Day, let's give children the tools they need to reach their goals. Pledge to our Focus on the Future initiative and make an impact in a child's life today. We are from the Caribbean islands, where the weather is warm and the beaches are beautiful. Like many parts of the world, cataracts are prevalent in our region, so we formed partnerships to lower waiting lists. It was a wonderful experience where colleagues turned into friends and more than 800 patients got to see again.
Welcome to Beyond Vision, an initiative under Trinidad Eye Hospital dedicated to restoring hope and changing lives. Many of you may remember our previous charity surgery programs, Gift of Sight and Sight Saver, under which hundreds of patients received life-changing surgeries. These programs have been a beacon of hope for so many, and we are extremely proud of the impact that we have made so far. With the continuous growth of our organization, we have decided to transform our charity efforts to reach even more people in need. And so, I am pleased to introduce to you Beyond Vision. Our aim is to restore and preserve sight, but we need your support. Join us in this journey, because together we can make a difference. Because we believe that sight is more than just seeing. We believe that the gift of sight is a gift of life, and that the gift of sight goes way beyond vision.
A cataract is one of the most common causes of blindness worldwide. What a cataract is it's a clouding of your eye's natural lens, and it occurs generally as you age. Cataracts cause blurry vision, glare, and difficulty seeing at night. And it's usually as a result of aging, but you can also develop them from other systemic conditions such as diabetes. There's also a trauma involved, certain medications as well. And even UV ray exposure can lead to cataract formation. Fortunately, cataracts can be treated effectively and safely with cataract surgery. And during this procedure, a cloudy lens is removed and a clear artificial lens called an intraocular lens is inserted. And this is commonly abbreviated as IOL. The surgery is one of the most common and successful procedures known to date, with high success rates in restoring clear vision. The cataract surgery process is usually around 20 minutes. And it's done under local anesthetic, so the patients are awake, but there's no pain involved in the procedure. Once the new artificial lens is inserted, most patients receive significant improvements in vision within only a matter of days.
When we started our eye care journey, our goal was to make high quality eye care available to all. Since then, our mission and vision has grown stronger and continues to unfold. Our new look and feel is a reflection of who we are. And as you experience it, we hope you get a sense of our values and our passion for serving your eye care needs. We are committed to the continuous development of a comprehensive eye care service that can provide greater access to eye care until we reach our goal of eradicating needless blindness. We are Trinidad Eye Hospital, preserving sight, enhancing lives.
Take a look at this scene. If you have healthy vision, this is what you see. But things look different for people with cataracts. When you have a cataract, the lens of your eye gets cloudy. The view is like looking through dusty glass. Over time, cataracts can make some colors harder to see, especially blue and purple. They can also make your eyes more sensitive to bright lights. Cataracts are common, especially in older adults. But cataract surgery can restore vision by replacing a cloudy lens with an artificial clear one. See what it's like to live with cataracts and other eye conditions with our virtual reality app. Search NEI VR, See What I See, on your phone's app store. To learn more about cataracts, visit nei.nih.gov.
It's a special occasion, the opening of a new office.
This team is so focused, dedicated, and committed. I think it's worth investing in them. And with this team and And if we have a location like this, we will do really well.
Space was a big concern for me actually when we were over at St. Augustine. So I am really, really excited. My goal here at Paget, our new location, is to actually promote more patient care.
Everybody, I think, is more comfortable in their space as well as the patients having like a wide variety of places to sit,
Based at the St. Augustine office, we basically were operating out of a room, a very small room. A lot of the clinic patients were not aware of what we offer. Now we are basically the center of attention here, and we offer a lot of really nice frames at really good prices, and we have a chance now to be more exposed to the clinic patients and external as well.
The flow, yes, the service flows. It flows. We came in, gave our name, into a room, then to the doctor. That was very good.
I love the new room. It's very modern, and the staff is extremely friendly, and again, they are very knowledgeable in what they do. So the experience is ultimate.
Well, it's well designed, and in this current climate with COVID, you will want to see your previous clinic was very congested and a lot of contact. Here you have enough room to socially distance people as well as to avoid any of those concerns people have in crowding. Secondly, your cubicles and the way you design the different sections much better than the last place,
The beauty of having this space now is that we've already created a team that could deliver that level of care. All we were looking forward to now is to create the space. I think that the quality of care that we'll be able to deliver now to the patients will be raised to another level.
As science continues to advance in the world of healthcare, people are starting to live longer at a higher quality of life. Although this is an amazing feat for science and society, we're going to take a step back from the world of technology and pharmaceuticals to take a deeper dive into what changes the average person can implement today to live a longer and healthier life. All links used for research in this video are available in the description below. Be sure to check them out. Now, let's jump into our 5 tips to live a long and healthy life. First, we're going to take a look at hydration. An estimated 75% of Americans suffer from chronic dehydration. So I think it might be time for you to reevaluate your personal levels of water consumption. According to a research paper from Harvard University, experts recommend that everyone should be drinking between 11 and 16 cups of water a day. Drinking enough water each day is vital for an abundance of reasons. It helps keep your joints lubricated, delivers essential nutrients to cells all over your body, keeps organs operating efficiently, prevents infections, and helps regulate body temperature. That's why a cold glass of water on a hot day feels like heaven. You could also see additional benefits such as improved sleep quality, cognition, and mood. Next, we're going to take a look at nutrition and supplements. Well, we all know to eat our greens and that McDonald's isn't the best food for us. But there's so much more to optimal nutrition than just eating right. The vast majority of us assume that the same healthy food choices are applicable for everybody. And for the most part, it is true, but everyone should take a customized approach. A simple blood test can tell you about your current baselines for nutrients within your body and where changes can be made. The average American diet finds a number of essential nutrients to be lacking. These areas include calcium, potassium, magnesium, and vitamins A, C, and D. Let's take vitamin D as an example. It is arguably one of the most important nutrients necessary for our health. According to a 2011 study, 1 billion people worldwide and 41.6% of Americans are vitamin D deficient. If you are lacking the vitamin, you could very well be lacking the benefits as well. Vitamin D helps your body fight disease, resulting in a reduced risk of multiple sclerosis, heart disease, and the likelihood of developing the flu. It has also been found to have an impact on mood regulation and potentially improving the symptoms of depression. This is just an example from one nutrient in the body. There are so many more that can affect the way your body operates. You can add these nutrients into your diet by eating the right foods with a high concentration of the nutrient, or look to take supplements that you can find in the drugstore. Before deciding if you want to take any supplements or making drastic changes, please consult a doctor, as I am not one. Just like the previous 2 points on this list, a large percentage of adults also lack sleep. According to the CDC, 1 in 3 adults don't sleep enough. The recommendation is that everyone should be getting between 7 to 9 hours of sleep a night. Having a consistent lack of sleep could lead to potentially the most drastic changes in health versus any other tip in this video. A lack of sleep contributes to a wide array of health complications and includes obesity, diabetes, high blood pressure, heart disease, and mental distress. We've all had a bad night of sleep before, and I'm sure you remember how miserable and difficult it was to operate throughout the day versus one where you get a good night's sleep. The culminating effect of these long nights and lost hours is referred to as sleep debt, a term that neuroscientist Matthew Walker often refers to. When sleep debt is incurred, it is extremely difficult to make back. For every hour of sleep lost, it can take up to 4 days to fully recover from its effects. When you have night after night of bad sleep, your sleep debt works up a tab, where it continues to accumulate and gets away from you. Dr. Walker believes that this conundrum can shave years off of your life. The best way to prepare for a good night's sleep is to put away screens 2 hours before bed and develop a routine that helps you relax. Unwinding and disconnecting from your daily activities is important for getting high quality sleep. Feel free to experiment and find out what works best for you before bed. Tip number 4 is to get exercise and stay active. We broke this segment down into 2 sections, and first we're going to talk about cardiovascular exercise. A lot of people have a misconception that cardio is limited to activities similar to running and cycling, when in fact almost any kind of movement can be classified as cardio. That means activities such as walking, playing sports, dancing, and even jumping up and down on a trampoline count. What these activities all have in common is that they trigger your body to take in more oxygen to maintain energy levels, which in turn increases your heart rate among several other reactions within the body. Getting your heart rate up is essential for strengthening your heart and overall health. According to the CDC, 1 in 4 deaths is caused by heart disease, which is why maintaining the health of your heart should be a priority for everybody. On top of that, it can improve your memory, protect your brain against the decline that comes with aging, and it also triggers the release of endorphins within your body. Endorphins are a natural hormone produced within your nervous system. They are often referred to as the happy hormone because it is known to make people happier. It naturally lifts your mood and is the hormone behind the phenomena of the runner's high. The next segment we're going to look at in exercise is resistance training. When it comes to resistance training, it turns out that there's more than meets the eye. That is not just for building strength and looking fit or muscular. A study done by Wayne L. Westcott states that it may help prevent and manage certain diseases such as type 2 diabetes by reducing visceral fat and improving insulin sensitivity. It also offers many of the same benefits that cardio offers as well. His research also proposes that it can increase bone density and help reduce pain associated with back problems, arthritis, and fibromyalgia. On top of all that, it can also reverse other skeletal muscular problems associated with aging. The U.S. Department of Health and Human Services state that you should do at least 150 minutes of moderate intensity physical activity a week to stay healthy. The last tip on our list is the importance of personal relationships. A review of 148 studies regarding social interactions found that people with strong and developed social circles are 50% less likely to die prematurely. And interestingly enough, it has been found that those who have committed to a life partner on average live 3 years longer than those who don't. When you have people in your life that you can discuss problems with, you don't have to internalize the stress. The science states that even just thinking about the people that you care about after going through a stressful event or task can lead to quicker recovery from the symptoms of stress as well. In turn, this keeps stress levels lower over time and reduces its long-term impact on your health. On the flip side, loneliness is often a significant predictor of poor health. For a long time, it has been commonly associated with depression and is now even being reported to have an impact on pain tolerance and immune system dysregulation. What a lot of people overlook is the preparation and changes influenced by being social. Being around people can promote several changes to your health, such as personal hygiene. Unintentional peer pressure is another influence when it comes to other health habits such as exercise, dietary choices, and certain activities that can have both a positive or a negative impact on your health. There are so many different factors that come into play when it comes to determining what a healthy life looks like for you. The items on this list and the research that the scientists did on these topics are just a few of the most popular health choices of today. Well, that is all for this video. Don't forget to like, subscribe, and turn on post notifications to stay up to date with our content. Thanks for watching, and we'll catch you in the next one.
Has your ophthalmologist recommended eye injections to treat your eye disease? You may be scared or anxious at the thought of your doctor putting a needle in your eye. Here are some things to know to help you feel less anxious. Eye injections are one of the most common eye treatments given by ophthalmologists. Millions of eye injections are given every year. Your ophthalmologist is a medical doctor and surgeon who is fully trained to give this treatment safely. Worried about pain? Your ophthalmologist will numb your eye with medication before the injection. During the treatment, you may feel some slight movement and pressure. Generally, most people feel little to no pain. You won't see the thin needle. The shot goes into the side of your eye, not the front, so you will be looking away from the needle when the injection is given. And if you're worried about blinking, your doctor will make sure your eyelids stay open during the injection, which only takes a couple of seconds. Chances are you won't even realize when it happens. After the procedure, your eye may sting a little or feel like there's soap in it. This is from the antiseptic solution used to clean your eye and prevent infection. Similar to other shots you've gotten, an eye injection might cause a slight bruise, which looks like a spot of blood in the eye. This is completely normal and will go away on its own over time. Knowing what to expect with an eye injection can help you feel less anxious about your treatment. If you have any questions, be sure to ask your ophthalmologist. As medical doctors and surgeons, they are committed to protecting your sight. Visit the American Academy of Ophthalmology's iSmart website to learn more.
Have you been delaying taking care of your eyes? You could risk losing sight of those you love the most and even put yourself in harm's way. Don't wait until it's too late. At CVRS, sponsor of Trinidad Eye Hospital, we can help. We offer surgeries for cataracts, retina, and glaucoma with subsidized pricing to suit your budget. See your loved ones clearly every day. Preserve your eyesight. Call us at 235-4834 today. According to WHO, globally, at least 2.2 billion people have a near or distance vision impairment. In almost half of these cases, vision impairment could have been prevented or has yet to be addressed. Cataract is responsible for 51% of world blindness. In Trinidad and Tobago, according to the 2013-2014 NEST study, cataract is a leading cause of blindness and moderate and severe vision impairment amongst adults. Since the onset of the COVID-19 pandemic in March 2020, it is estimated that thousands of cataract surgeries were cancelled, delayed, or put on hold, both regionally and internationally. As a result, many persons are at risk of permanent vision loss due to delayed review or treatment. Some patients decided to share their story with us.
I can't see the walk normal and things. I have to walk with a stick because I see cloudy, the eyes cloudy.
Her right eye, she was not seeing properly at all.
He always had to take pain tablets because his eyes was just, and it was like blood red.
Hardly seeing glory in the eyes.
I can't see nothing. I can't even see the plate of food I eating. I can't really see nothing. I just have to feel. You understand?
Very long time. So I decided, yeah, long before COVID. 2 years now.
A few months, well, that the eyes get worse. The eye, especially this one, he left.
He went once, but you know the length of times, the length of time that the appointments and things like that, it wasn't working out fast because his eye used to be painful. So he decided to go privately.
He put in, look, since the beginning of, I think, this year, I think it was February, they put the appointment for quite August of this month.
You reach into the hospital, right? You cannot get no help in the hospital because that is going to take years.
Do back, repeat what she couldn't do in school, what she didn't get through her subjects. She wanted to do that because, as I say, with this just one eye, and you know she cannot see properly to read, you know, with just one eye. So it's a kickback, it's a big kickback in her entire life as a young woman.
I have prosthesis, and I can't even use it. To say, well, take a chance to use it because I not see nothing. To put it on. And so, if I could get back with one of the eye, because there's two eyes, right? If I could get back inside on one of the eye, I could still sit up and use the prosthesis to move around without asking somebody for help now. You understand?
Age-related macular degeneration, or ARMD, is a slow progressing eye condition whereby the macula, or the area responsible for central visual acuity. So that part is where all the fine details come from. So specifically things such as reading and facial features. So there are two main types. There's the dry and the wet type. The dry type is usually slow to progress. The wet type can progress rapidly. Once detected early, even the wet type can be treated and the progression can be slowed, thereby preserving vision. If you fit the criteria of the risk factors, so that'll be family history, you're elderly over 50 years old, you have a strong smoking history, you should be screened. Screening involves a dilated exam inclusive of a OCT macular scan, and these will help to detect any early changes that may not even be detectable by you yourself.
So there's no cure for ARMD or age-related macular degeneration, but it depends on which type of ARMD that you have. So if you have dry ARMD, usually treatment is monitoring the patient for symptoms or worsening of the symptoms, and also treating with supplements, vitamins, healthy diet. If you have wet ARMD, usually the treatment involves more advanced medical intervention, such as injections or laser therapy to the eye. Early treatment is important because if it's picked up at an early stage, you could actually help prevent vision loss. If you pick it up too late, then the vision loss may have already been occurring, and therefore now it's time to prevent further vision loss.
There's definitely a correlation. When somebody loses their sight, they're no longer able to sometimes keep the jobs that they have. The quality of life is totally different. It becomes a bit more of a burden so to speak, on the finances of the country, their family, but on the country as well, because then they may be more dependent for certain benefits and that sort of thing. And I think at the end of the day, a lot of people want to improve the quality of the life they have, and not being able to see definitely impacts that.
So if you wanted to target a population of people ready to change the eyesight of the adult population, you'd be looking at cataract surgery. It's a quick surgery, produces fantastic results, and really relieves the burden of vision impairment in a country, and is economically one of the best ways to really transform a country.
I think it's made a huge difference, not just for our hospital in terms of improving the level of service that we offer to our patients and families, but especially for the people, and that's what it's all about. This has definitely changed the lives of many people.
Because before the surgery, they might be struggling to do simple things we take for granted, like eating food, going to the bathroom, brushing teeth. They can't find their things, and they're really dependent on others for simple tasks. After the surgery, they're walking briskly around, coming in to see us, smiles on the face. So it really lights up the room.
I'm so happy. My family was happy. My dad was in tears. They are in the States. My aunt, all of them. I called them up yesterday. My brother. They were all happy for me because I'm still young, I'm in my 40s. And I have a right to see again. Yes. And when the doctor asked me if I wanted both eyes, I was like so happy yesterday. Yesterday was the happiest day of my life.
The inner eye is filled with a clear, jelly-like substance called vitreous. As we age, the vitreous becomes less like jelly and more like liquid. Usually the vitreous is only loosely attached to the retina, so as the eye moves, the vitreous moves away from the retina without causing problems. Sometimes, though, the vitreous pulls hard enough to tear the retina. Fluid passes through the tear and lifts the retina off the back of the eye. This is called a retinal detachment.
At CVRS and the Trinidad Eye Hospital, we take care of all your family's eye care needs. Get comprehensive eye exams for the entire family, and then get referred to our in-house ophthalmologist if needed. We have a wide variety of sunglasses and frames for adults and children, and you can even get contact lenses too. Call us at 620-1025 today.
So today we'll be highlighting pterygiums, which is one of the common eye conditions that we see here in the Caribbean especially, given its link to UV exposure, but also with wind, dust, sand, and heat. Pterygiums are usually a growth of fleshy pink material that starts on the white part of the eyes and slowly extends over the cornea in time to come. If you do have a pterygium, you may experience redness, irritation, sometimes a gritty sensation, or a feeling as if something is in the eyes. In these instances, it may be recommended to use lubricating eye drops or ointments, and sometimes in extreme cases, mild anti-inflammatory drops. But in other cases, if the pterygium does extend over the cornea, surgery may be warranted in those instances. Surgery usually involves a removal of the pterygium or the fleshy overgrowth of tissue and covering that area over with either a graft or synthetic tissue in order to preserve the health of the underlying area and also to prevent regrowth of a pterygium in years to come.
Yeah, I recorded.
This city can't hold me, my vibe's too high, and my heart it told me jump right now, you will touch the sky. Feel my love unfolding like a laughing flame. All who did not know me when I done, they gon' know the name. Million people coming down, dancing to a song. Love is life and life is love, blessings from above. Can you feel the love that's in the air? Well, if you feel it, let me hear you say, dancing, moving, grooving everywhere. If you feel it, let me hear you say, na 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 na, eh na 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 na. Take me to the river, take me to the sea. Wash over me music, bathe me in your melody. We are such a blessed tribe, sweeter than a million bees. People live 1,000 lives and never feel this free. Million people coming down, dancing to a song. Love is life and life is love, blessings from above. Can you feel the love that's in the air? Well, if you feel it, let me hear you say, dancing, moving, grooving everywhere. If you feel it, let me hear you say, na 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 na, eh na 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 na. Na 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 na, eh na 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 na. Can you feel the love that's in the air? Dancing, moving, grooving everywhere.
My name is Joshua,
My name is Stefan.
and we brought green apples.
Did you know that the act that now you look again.
This city can't hold me, my vibe's too high, and my heart it told me jump right now, you will touch the sky. Feel my love unfolding like a laughing flame. All who did not know me when I done, they gon' know the name. Million people coming down, dancing to a song. Love is life and life is love, blessings from above. Can you feel the love that's in the air? Well, if you feel it, let me hear you say, dancing, moving, grooving everywhere. If you feel it, let me hear you say, na 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 na, eh na 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 na. Take me to the river, take me to the sea. Wash over me music, bathe me in your melody. We are such a blessed tribe, sweeter than a million bees. People live 1,000 lives and never feel this free. Million people coming down, dancing to a song. Love is life and life is love, blessings from above. Can you feel the love that's in the air? Well, if you feel it, let me hear you say, dancing, moving, grooving
Always investigation and thing too. I will find out why that boy blushing so much when all they come here.
It's a good looking man.
We know.
So the retina in the back of the eye is one of the most highly metabolic tissues in your entire body, meaning it thrives on having good nutrition. And many foods and nutrients have been found to not only delay, but also prevent eye diseases and help improve your eyesight and visual function. So in this video, we're going to share my 5 best foods for eye health and vision that you can start eating today. Let's take a look. Hey, what's up? Dr. Allen here from the Dr. Eye Health Show, helping you to see your best today and also tomorrow. Now, number 1 on our list for the best foods for your eyes is, funny enough, not carrots, believe it or not. In fact, sweet potatoes. And the reason for this is because sweet potatoes have almost double the amount of vitamin A that a carrot will in a single serving. Perhaps the best well-known nutrient for the eye is that of vitamin A, which is an essential nutrient that's needed for the ability to detect light within the retina and sends chemical signal to your brain to form images to let you see. This happens to be most helpful for seeing in low light situations, such as maybe driving at nighttime. Vitamin A also plays a role for prevention of dry eyes. In fact, eye doctors like myself are trained to always look at the surface of the eye for the growth of something called a bitot spot, which is something that we see in people who are severely vitamin A deficient. Yes, carrots can help you with vitamin A, but sweet potatoes, again, have a little bit more, and personally, are just a little bit more my favorite. Let me know in the comments if you prefer carrots or sweet potatoes. Number 2 is that of eating green leafy vegetables, such as kale and spinach. And that's because green leafy vegetables have been found to have high concentrations of lutein and zeaxanthin. Lutein and zeaxanthin are carotenoid pigments that are found in super high concentrations in the macula in the back of the eye, which is essentially the bullseye of the center part of your vision that gives you good, sharp reading ability and your ability to see colors. Lutein has been found to play a significant role in reducing chronic eye diseases such as cataracts and macular degeneration, and basically acts like a natural blue light blocker for your eye. There's even studies showing support that lutein can help with diabetic retinopathy. And hey, if you're like me and you don't like eating salads, that's okay. Throw this into a blender, make a green smoothie out of it, it's delicious. Plus there's like 1.5 million different recipes for green smoothies, and spinach, when it's blended up, you really can't taste it. So if you haven't tried them, I suggest it. Number 3 on best foods for the eyes is fruits that are rich in vitamin C, such as citrus fruits such as oranges, tangerines, and even lemons. Vitamin C is a critical antioxidant in our body and is found in really high concentrations within the aqueous fluid inside of the eye. This basically works to help prevent free radical damage from all of the unhealthy parts of our lifestyle, whether it be food, daily habits, or just environmental exposures. And so vitamin C is constantly helping to prevent things like cataracts and macular degeneration inside of your eye. So yes, get your vitamin C. Okay, maybe don't bite into a lemon. Number 4 on our list are foods rich in omega-3 fatty acids. Some examples include having salmon, tuna, other cold water fish, or perhaps a nut or vegetable source such as walnuts. Omega-3 fatty acids play an important role in the development of our brain at an early stage, and even for the development of the retina in the back of the eye. And studies have even shown that diets rich in omega-3s have helped with patients who have macular degeneration, diabetic retinopathy, and even dry eye disease. Some people may choose to go the route of omega-3 supplements. However, some studies have found that people eating a diet source of omega-3 have had better results for different eye health conditions versus doing supplements alone. But I do recognize that there's a lot of research on this area of omega-3 supplements specific, not just in eye disease, but in heart disease, bone health, brain health, a lot of different parts of science. And it's something that I've been studying on my own accord and hope to have further videos specifically around omega-3 supplements and for the eye. And so if that interests you at all, definitely I encourage you to subscribe to the channel if you haven't done so already. That way you'll be notified when that video comes out. Otherwise, as always, if you're considering taking any supplement, I always encourage you talk to your local eye doctor or healthcare professional in your area just to make sure it's an okay choice for you. Now, finally, number 5 on our list is that of foods rich in vitamin E and zinc. I know beans and legumes are an easy way to get a lot of zinc into your diet. Zinc plays an important role in helping convert vitamin A into melanin in the back of the eye, which is very protective against oxidative damage and damage from sunlight and other sources, and has also been found in the prevention of cataracts, macular degeneration, and helping with low light situation and night vision problems. Vitamin E has also been found to be super beneficial for the health of the eye and can be easily found in things like avocados, almonds, and sunflower seeds. Hopefully you found this list helpful and educational. If so, smash that like button for me and let me know in the comment section some of your favorite foods and if they made this list.
The silent thief of sight. What happens in glaucoma is the disease is going on in the eye and you don't know because there is no symptoms in the majority of cases. So glaucoma is caused, we think, by the pressure in the eye going up in the majority of cases we see because of clogging of the drainage system in the eye. And this here is an eye model. And basically fluid is produced in the back here, just behind the colored bit of the eye, passes through the pupil, the little hole here, and drains out into the drainage system in the front of the eye. And we think over time, just like a sink, it gets clogged up. And that clogging up causes the pressure to rise. And as the pressure rises, it puts pressure on the optic nerve, which is here, and it causes damage to the nerve over time. So 2 things we check when you come into the office. One is we check the eye pressure to see if it's going up, and we take a look at the optic nerve to see if it's getting damaged. And that's how we diagnose it. The different types of treatment for glaucoma, and I'll talk about 2 to start with, which is drops and laser. The compliance with drops is really difficult, to give somebody to have to use a drop for life every day. It's an onerous process. And laser is a one and done procedure. It lasts on average 2 years to 5 years, and we monitor the eye pressure. The other recent innovation in glaucoma treatment called MIGS. And microinvasive glaucoma surgery involves opening up the drainage channels with surgery. And those 2 procedures are highly effective and really prevents you from needing either drops all the time or needing to have major glaucoma surgery. I know we might have persons who would be listening to this video and they have glaucoma and very worried that they're going to go blind, they're going to lose their vision, or the treatment may affect them. The laser, for instance, they think might burn the eye or cause some harm. The answer is no. Don't be worried. Because of the advances in the treatment, we have been much better at controlling the disease. The aim in glaucoma treatment is to prevent deterioration in vision. It cannot bring back what you've actually already lost. And that is why it's so important to stress getting your eyes checked. Because if you've lost a bit of vision already, you could end up losing more vision, and we can't bring back what you've lost. So it's important that we save what you have. So get your eyes screened.